welcome to this surgery Q&A session with Saurabh Sinha. He is a paediatric and adult consultant neurosurgeon, and he's also part of our medical committee at the Pituitary Foundation. So today I'm going to be asking him your question. What is the procedure for reviewing a patient's tumour residue for regrowth using repeated MRI scans?
Again, that really depends on local protocols. I think in Sheffield, we would normally do a first scan at 6 months. And then if the first scan at 6 months was stable, we'd scan them annually for a few years. And if they were still stable, you try and increase that interval to maybe every 2 or 3 years. The evidence suggests to a large extent that if things haven't come back at 10 years, the chances are they're probably not coming back. And so at 10 years, we would stop scanning unless the patient had, unless there were major concerns. And what we would say to patients, or what we normally say to patients is, you know, got 10 years, nothing's come back, everything's fine, but you'll still be under endocrine review for the rest of your life. The endocrinologists never, ever give up their patients, ever, from what I can gather, which is always useful. And clearly, if you develop new symptoms or recurrent symptoms, then you would get rescanned again, no matter how far you were down the line. If you've got a tumour you were a little bit more anxious about, you might do your first scan at 3 months. If you felt it was something that was a little bit more aggressive in your standard pituitary tumour, but usually 6 months is okay for most of them. If your tumour is a functioning tumour, so if this is a patient who's got acromegaly or Cushing's, or actually a prolactinoma, there's an argument for not scanning them at all, because if you've done the operation, then actually you can follow their progress with biochemistry. So if their acromegaly is completely under control, the scan's going to be, and the same with the Cushing's, and the scan's not going to be of any help whatsoever. So yeah, you don't need to follow them up with an MRI scan unless there's a good reason.
I had surgery to remove a pituitary tumour in March 2019. I've since had an MRI which came back clear. I've now been sent a letter telling me to go for another MRI in July. I hated the last MRI as I'm claustrophobic. Is it really necessary, or could information be gained from a CT scan?
Yeah, so the MRI is much better for looking at pituitary tumours. An MR itself is much better because it doesn't involve any radiation, so it has less of a long-term risk than CT. But you're not alone in being claustrophobic and hating MRI scans. That's not unusual. So there are several options. One is you can have the MRI under general anaesthetic. You can be put to sleep and have it asleep if you're really that bad. There are scanners called open scanners, where they're much bigger. I've never actually seen one, but I'm told that they're not claustrophobic at all. And the third option is, yes, you can have a CT of your pituitary. It's not as good, but actually it will do the job to a large extent. I guess we're looking for a large lump coming back, so you should easily be able to see that on a CT pituitary. But the issue is it's radiation, and if you're having that scan every year, it's a radiation build-up over a long period of time. But no, it doesn't have to be an MRI scan.
I had a pituitary cyst successfully removed in December. I take hydrocortisone 20 milligrams per day and now feel perfectly well. Is it common for periods to return following surgery, and are there options regarding fertility and trying to conceive after surgery?
So I'm assuming that's a woman, so yeah, okay. Otherwise we would be having a slightly weird discussion. Okay, where were we? So yeah, periods might. So if the cyst was large enough that it was causing a problem with the pituitary stalk, you get what's called stalk effect, and you get a rise in your prolactin, and a rise in prolactin will make you have no periods, what we call amenorrhea. So if the cyst has been removed and the pressure of the stalk has gone away, then the prolactin levels will fall and your periods should return. Okay. From a fertility perspective, if your pituitary function is normal, then there's no issue from a pituitary aspect for fertility. If the pituitary function, if your if you're hyperpituitary, then you'll need help. And again, your nice, lovely endocrinologist will be able to deal with that.
I had transphenoidal surgery in June and I'm experiencing constant headaches and tinnitus. Is this likely to go away?
I would hope so. I mean, it's not uncommon for patients after pituitary surgery to have some headache. I'm not entirely sure the exact mechanism of it, but lots of my patients say that they have it. So, it's clearly a common finding. Usually most people say it's slap bang in the middle of my forehead. And it usually settles down within a few days, if not a couple of weeks. Surgery was only in June, so it's not that long ago, so it's probably not a surprise. The tinnitus is much more difficult to explain. I can't really explain why they've got tinnitus. We're nowhere near the nerves to the ears and hearing. That's a long way away from where the pituitary gland is and where the surgery will be. So I don't think I've got an answer for that. I'm sorry. But the headaches, yeah, I think that will go away with time.
We had lots of questions about this one. So, does transphenoidal surgery mean I need to take certain precautions or avoid some activities after initial recovery? So, COVID tests, open water diving, that kind of stuff.
Okay, so there isn't any evidence at the moment that having a pituitary problem puts you at any risk of COVID. So long as you are, so the hormone, we know that patients who are immunosuppressed have a potential risk from COVID. But remember, for pituitary patients, we're not giving you extra hormones. We're giving you what your body should have been making anyway. So if you're on hydrocortisone, which is a drug that people worry about, you're only actually being given what your body would have made. So there's nothing to suggest that you're at any higher risk than anybody else. As to avoiding things, so yeah, avoiding the COVID test so that someone doesn't stick a big swab up your nose, yeah, absolutely. That needs to be avoided for anywhere up to about 3 months afterwards. You can have the throat swab, but you shouldn't stick something up your nose. Otherwise, your surgeon will be very upset if you come back with a CSF leak and they thought you were okay. And then the diving. So that's a really good. That's one that there's been lots of talk in the kind of pituitary surgery world for a while. I think if you've not had a CSF leak, if you've had it repaired and there's been no further problems with CSF leak, then I don't see any reason why 6 months or so down the line you shouldn't be okay. Although lots of diving schools are reluctant to let you do a PADI. There was a big discussion on one of the skull base websites about it, and there are plenty of people who are diving again, usually a year or so after surgery, and when surgery's not been complicated.
So with the COVID tests, how long after would you say it would be safe?
To be honest, I'm guessing that 3 months should probably be all right. I mean, we know that if we take patients back to theatre a few months down the line, everything's scarred up and it's difficult to see what's going on. So suggest that you could probably get a decent nasal swab. I mean, you have to go a long way to find pituitary. The nasal swab shouldn't be able to go that far back, and actually shouldn't be going in that direction. Shouldn't be going towards the sphenoid. It should be going to the back of the nose. But yeah, I would, for paranoia's sake, and to stop your surgeons from having a heart attack, give us 3 months, will you?
I've just gone on to a monthly injection of Somatuline and was just wondering how long it is before you feel the benefit.
So the benefits really depend on what your symptoms are. You should, as the growth hormone levels come down, you should find that symptoms such as sweatiness, certainly headaches from acromegaly are usually super sensitive to somatostatin analogs, so that should get better very quickly. And sweating often gets better quite quickly too. The crux of it is it depends on how sensitive your tumour is to somatostatin analogs. And the more sensitive it is, the quicker you will feel better. We know that in young people, so under the age of 30, then they're less likely to respond to somatostatin analogues, so they may not feel better at all, predominantly because it's not having any effect at all on their tumour.
For a while, I've had a pulsing and whooshing noise in my left ear and wondered if this could be connected to residue tumour.
No.
Great.
I refer you back to the answer earlier on. The ear is a long way away from your pituitary, and the hearing nerves are way behind where you should have been operating. So no, I'm happy to absolutely say no to that one.
Okay. I had surgery to remove my pituitary last May for Cushing's disease. The whole tumour could not be surgically removed, resulting in 5.5 weeks of radiotherapy. At what stage do you know if the remaining tumour has been controlled?
So radiotherapy works slowly, especially for pituitary disease. Because pituitary disease is benign, radiotherapy takes much longer to work often. And it can take somewhere between 3 to 5 years before you can get control with radiotherapy. The good news is once you've got control, it usually stays well controlled, but it can take a significant period of time. As with all charities, COVID-19's had a massive impact on the amount of funding that we have been able to get. And the Pituitary Foundation, like every other charity, is clearly seeing that as having a massive negative impact on the amount of money that they would normally be able to raise. You may know, Jay has set up the 500 Faces charity for the Pituitary Foundation. It's a brilliant way of raising money for the charity. If you can raise or get a donation of £100, you'll get your face plastered all over the 500 Faces website and join some of us who are already on it. As most of you know, the Pituitary Foundation does a brilliant service for patients who have pituitary disease and their families. It's an excellent place for getting support for people who have a rare condition and often don't really know where to turn to get help. So please, anything you can do to support us, that would be great.